Good morning, or good afternoon, I should say. Apologies for having missed you earlier. We did have basically crisis after crisis today, and unfortunately, I was able to join a little bit after you all had left. But I hope this recording is worthwhile. I like to start with images. We can see that this is an inversion. Of course, we have snow right now. This was taken last year. And what I'm going to be discussing is the indoor and outdoor air quality, health, and economic and policy impacts. My name is Daniel Mendoza, and I'm a professor of atmospheric sciences, internal medicine in the pulmonary division, and also city and metropolitan planning. So I always like to start with acknowledging my research team. We have members that range from medicine, basic sciences, social sciences, because what we really want to focus on is transdisciplinarity, which is interdisciplinary research that actually gets translated into policy or actual change. Now, this slide, I always like to start my presentations with this because I want to show you what happens after 3 months. I was able to identify some of the cleanest air in Salt Lake City. That's where I'm living right now. I've also done substantial work in making my house as impermeable to outside pollution as possible. And despite all of this, I still have contaminants going in. This, again, is only 3 months of air pollution, and it's really during inversion season, also wildfire season, that I capture some of this. And I have to change the filters because I am an asthma patient and I need to take care of what I'm breathing. So our team really focuses on developing equitable and inclusive environments. What does that mean? We first start with environmental exposures. This is the first part. We want to either model or measure what's going on in terms of contaminants that people may be exposed to. To then, we tie that to health outcomes. So what are potential health outcomes? Is it, for example, respiratory conditions? Is it cardiovascular conditions? And then we like to look at the economic costs of this. So what are the costs of action or inaction to then develop public policy? This is the work that we then take to stakeholders, to legislators, because I always like to say when I was wrapping up my PhD, it was in greenhouse gas emissions in urban environments. I realized that about 50% of people believe in climate change, about 100% believe in lung cancer, which is why I pivoted towards health. Now, after working in, let's call it the real world outside of academia and really trying to enact policy, I realized that even though 100% of people believe in lung cancer, about 150% of them believe in the dollar. So we need to make sure that the solutions that we present make economic sense. And then with this policy that we develop, we look at urban planning. Now, urban planning is a very catch-all term. It could also be policy changes. It could be, for example, the development. How are we going to build potentially a new road, etc. So that's a very generic term. And so this is where this cycle ended really back in 2019. But as we know, everything changed around the world in 2020, and really equity was brought to the fore because we know that there's some substantial differences between social demographic groups in terms of really even access to education, even access to learning and understanding what could be affecting their health. So that's what the focus of our team is. Just to give you a very brief example of the substantial differences that we have just in our backyard in Salt Lake County. These are some social demographic maps where we look at racial composition, occupation, as well as income distribution. We know anecdotally, but now you can see the data right in front of you, in terms of the vast differences between the west side of Salt Lake City, so the primarily northwest part of the county, including West Valley as well, and the east side of the county. How does this get reflected in actual health outcomes? Well, these are the COVID-19 positive cases. This is back in early 2020 when we had that lockdown and then the end of the lockdown. Those are the vertical lines, disaggregated by income and racial composition. We can see that at the start of the lockdown, most groups really had very similar contagion rates. But then the differences really started during the lockdown. Why? Well, multiple reasons. One, it was that many of the higher income populations were able to work from home. or simply choose not to work and not be exposed to the virus. Whereas many of the lower income populations had to work. They had to go, and some of their jobs were high contact jobs. They would be, for example, warehouse workers, distribution workers that had a lot of contact with other people, so the contagion rate increased. Many of them lived in multicultural homes, multi-generational homes. So instead of just having, a couple of family members and potentially a quarantine room, which we heard that term, where a person who was infected would just go to one room and have minimal contact with the family, many of these community members would live 2 to 3 to a room. So therefore, if one family member was infected, it was likely the entire family was infected. So how do we know the first really analysis or the first cut that we had, which is really just human activity, people moving around? I call this slide the tale of two zip codes. 84104 is the Glendale area, one of the lowest income zip codes, and as well as one of the most racially diverse zip codes. That's on the left panel. And then on the right panel, we have Yale-Crest, which is just south of the University of Utah, much higher income, much more homogeneous population. And you can see very clearly the difference in traffic patterns when there was the stay-at-home directives. The traffic on 84104 barely decreased, around 5 to 10%, whereas the traffic in Yale-Crest dropped by about 50% and didn't even rebound as much afterwards because people found solutions to stay, to continue working from home, or just not be exposed. So there are substantial differences in human activity, which we believe were the main cause for the difference in contagion. So now let's talk about air pollution. So this is our first article that looked at the TRACS light rail observation project. So we have sensors on 3 of the TRACS trains, and this is a map of where the air quality stations are. We have some from the Division of Air Quality, which are the regulatory sensors. We have some of our stationary ones, the red diamonds, and then we can see that we have sensors. They run on the red, the green, and the blue line now. There's some of the interesting or important sources of pollution, which are the roadways. I've highlighted there. And then I also have a map of underlying of population density. It just gives you a little bit more of an idea of our study area, which is our county. This is our air quality dashboard, where we see what sensors are around and what are they reading. I mentioned the TRACS, which you can easily see. The TRACS trains were all 3 of them were running at the same time, which is one of our ideal observation days. But then we also have now added 3 electric buses that now have air quality sensors there, and you can start to see what the patterns are. So that's primarily here. If you can see my cursor on the top left side, that is the bus number 509. And then you can also see the other stations that are stationary as well. So this is real time. This was taken on actually February the 10th of this year. So you can see some of the gradients there in terms of air pollution. Though, by the way, the color, these are color coded by air quality index colors. So you can see across the valley how the elevated benches, which would be in the southwest, the northeast, and the north, and the southeast portions have much less pollution than the lower parts of the valley. Well, what can we do with this? So in 2019, we decided to we had some measurements to look at the impact of fireworks. And now we can see right before the fireworks go off at 9 p.m., top left, we see that it's green air quality, very clean. And then all of a sudden, as soon as we start to get some of the fireworks by 10, 11 p.m., we're starting to see the hotspots grow. That is by International Peace Gardens, Northern Park. That's where the hotspot there, that red dot. And then what we can see on the last panel there around midnight is when we see the downwash from, that is Emigration Canyon. All that is clean air coming down and washing out the air. So that is one of the sort of double whammies that we have here. First of all, the west side had hosted the fireworks, so not only were they more polluted, but then more of that air was sort of compressed in that area, which made it linger much longer. This is the image of the entire county, and you can see a different fireworks display going off at different times. Some of the fireworks start around 9 p.m., some around 10 in different parts of the county. You can really see the hotspots building up, and really it all ends up getting pushed towards the northwest part of the county. which is around the Great Salt Lake area, around by the airport. So this is all really a combination of the valley, the geography itself, as well as where are these emission sources. That's really great information for outside, but the reality is we spend about 90% of our time indoors. So here we can see what the differences are in terms of indoor and outdoor air pollution. We can see that for panel A, we looked at an inversion event. We had sensors on the rooftop, the air handling room of a building, as well as its office. For the inversion event, the air handling sensor went out, but the reality is the air handling and the rooftop are very similar. It's just air going into a room, and that's where it gets processed to be distributed throughout the building. You can see that during the inversion, not much went inside. In fact, the indoor air quality was fairly good. The reason for that is that inversion events, what they do, as you probably know, is air gets trapped. And so that's why we build these hotspots. That's why we really see that smog growing day after day. It's because air is trapped. There's essentially a metaphorical lid. It's actually a physical lid in a sense in terms of air pressure. And so what this creates is this sort of perfect environment in a sense for what we call secondary PM 2.5. Primary PM 2.5 is what comes out of a smokestack or the tailpipe of your car or any other kind of combustion process. Secondary is because now we have the specific conditions, now these chemicals can start to swirl around and mix and become also PM 2.5, which it's not directly emitted, and it's created, and that's why we call it secondary. So that is what we see there. Now, these conditions, again, remember, it's an inversion event. So what happens is we have higher levels of humidity and lower temperature. As soon as that air gets brought into a building where it's much warmer and much drier, those secondary PM 2.5, they dissipate and they actually become its elemental components, which are no longer PM 2.5. So it's not necessarily the building is filtering very much. It's simply the conditions are so much different inside compared to outside that these particles just disappear in a sense, a large amount of them. Now, the wildfire event is quite the opposite. Wildfire particles are smoke particles, and they're actual real particles, meaning that they're going to be invariant. They're primary PM 2.5, so it doesn't really matter whether it's hot, whether it's cold, humid, or dry. These particles are going to persist, and they tend to be somewhat smaller, especially if there's a remote fire. So, for example, any of the fires that we notice in California or the Pacific Northwest, they have to go over the Sierra Mountains. So those particles, the larger particles, would just fall off and actually just be trapped by the mountains themselves. So the particles that actually reach us are much smaller, so they're sometimes much harder to filter out. So that's why so much more actually gets into the building in terms of wildfires. And when we look at fireworks, notice the scale. So we've all heard about red air quality days, which is fairly bad for our health, but there's also purple, which is beyond that. It's about 3 times higher. And you can see how in the air handling room and the rooftop, it gets to that level because the fireworks are simply creating so much pollution. Now, fireworks have a mix of both primary and secondary PM 2.5, so that's why you see some of that percolating into the office. Unfortunately, one of the largest sources are private fireworks. There are several hundred private firework events that happen every year in Utah, and you can see how the magnitude, even though it's a much shorter time period, of course, than let's say a wildfire event or an inversion, it's still much sharper. There's so much more pollution coming from that. So we need to really be aware of things beyond inversions. Most people, when they think of Utah pollution, they think of inversions, but the issue is we have so many other sources of pollution that are really generally understudied. So now if we want to look at what is this really doing to us? Well, some of my work really specializes in educational outcomes and really pediatric research. So one of our studies was looking at 3rd grade students' standardized test results following air pollution events. And we saw that across Salt Lake County, so we looked at several hundred schools actually, there are substantial differences in test scores following, and as you can imagine, lower test scores following elevated pollution events. And then I also looked at absenteeism. There's, again, a substantial and statistically significant difference in terms of, and much higher, of course, absenteeism following air pollution events. What are some of the differences that we notice? I looked at 38 schools in the Salt Lake City School District for one study. And what we did was we mapped them out by longitude. And here, all the schools, it's probably very hard to see the text, but the more red, the more west, and the more blue, the more east. And you can see that the west side schools have almost twice as high PM 2.5 during December, which is really our the beginning of our inversion periods. You can see that this is a very, very clear contrast in terms of what are kids being exposed to when they're potentially go outside to recess, or when they're just potentially even just going to school or leaving school. This is what they're being exposed to, and you can see the very notable differences depending on what part of the region they are. For ozone, it's actually the opposite, because again, this is an elevation factor. I'm not going to discuss too much about ozone right now, because we're limited time, but ozone actually tends to naturally be higher at higher elevations. And so you see the pattern inverted during the summer. So this is a fairly quick video. This really prompted that study. We had a dust event in 2017 and 2018. And so we can really see how, and this is the view from the University of Utah at the William Browning building, looking towards the city. So we're looking westward. So what happened was there was some dust coming from the Great Salt Lake, and also we had some farmers tilling their fields in Utah County. And so both of these masses of dust just converged in Salt Lake City and made it really difficult to see downtown. This what really prompted me to think about, if you see the timestamp, this is recess time for kids. Were kids allowed to go out? We're not really sure what happened those days. And so what I wanted to do is really, as I mentioned, let's start looking at the economic impact, because if kids were out, they were exposed to high levels of pollution, what could have happened the next day? So as I mentioned, we did see that there are associations of increased absenteeism after exposure. So what are some of the economic impacts? Well, there are three impacted groups that we looked at. Schools in Utah they receive in terms of budget $40 a day per student. Families, the average wage at that study period was about $23 per hour, and 56% of students in the Salt Lake City School District depend on free and reduced meals. So a family was losing approximately $200 in wages if a parent had to stay home to take care of a sick child, and they also had to feed this child because then the school wasn't feeding them. And there's this other term called economic multiplier. Conservatively, we used the 2.5 multiplier. Could have gone as high as 3.5 or 4, but we wanted to take the bare minimum. Because this economic multiplier, what this means is that for every dollar of your wages, $2.5 go into the greater economy. To give you a quick example, let's say you need to have some work done in your home and it's going to cost $10,000, as the contractor tells you. Well, the worker that's doing the work is probably going to earn only about $4,000. The remaining $6,000 is going to go into materials, transportation, taxes. So for every dollar that is no longer your wage, $2.5 is not flowing through the greater economy. So that means that the estimated impact using these numbers and the number of absences was about $450,000 a year, which is substantial just in the Salt Lake City School District. This really prompted some policy work. So I worked with Representative Mark Weekly to pass a bill here in Utah so that every school now has an emergency asthma inhaler. This is really, in addition to the EpiPens, we all know that all schools have EpiPens in case of emergencies. Well, we realized that asthma inhalers are essentially very similar and potentially much greater use. And the reason for that is, when discussing with administrators, many of them mentioned, yes, we know we're sharing the full day absence data with you, but in terms of part day absences, many times we have many students that go out to recess and then they come back with an asthma attack, and then they have to either go home or they have to go to the hospital. So by doing this, now we're hoping to curb that number of students who miss half a day of school. In terms of environmental and social justice, it's also very important because we are providing some medicine, potentially the only medicine for some of the lower income kids who may not have any other kind of asthma medication. I take 3 asthma medications a day. These kids may not, their families may not be able to afford that. So we're at least providing some level of protection. So when we're looking at emissions, this is an emissions map in terms of Salt Lake County, Salt Lake City. We see some of the commercial sources. Here are, I've studied 2 schools that I'm going to show in the next study. This is West High School and this is East Side School. You can see how different the emission profiles are. In East High School, you have basically just a few roads that are fairly well traveled. This 1300 East. For West High, I mean, we're right next to the freeway. We've got the airport nearby, a railroad. We have some commercial buildings. So we can expect that there's going to be a substantial difference in terms of the outdoor air pollution. So we have outdoor and indoor air pollution. And this is an example of an inversion. So we can see how West High, which is this green line, has much higher outdoor air pollution than East High. However, the inside air pollution, fortunately, is fairly similar. So that is really encouraging to see that even though outside air pollution could be very different between the 2 schools, really you can take a look right here, for example, and you can see that it's almost a factor of 3 to 4 higher at West Side versus East High. But inside, it's fairly similar. So what we wanted to do is go the next step and try to understand what is the lag in terms of outdoor pollution going inside. What that meant is I compared the outdoor pollution and the indoor pollution, then lag, meaning delayed the indoor pollution by from 0 to 180 minutes, basically 3 hours. So we'll see how long it took. And we found that there's a 57-minute lag, and it's a fairly high coefficient of correlation. So what this means is that it takes about 57 minutes for that outside signal, meaning that outside pollution, to make its way inside to the classrooms, which tells us that now we have some metric to really understand maybe potentially changing building schedules to try to reduce some of that ventilation during the peak traffic hours so that pollution doesn't go inside the schools. Similarly, we did some studies during a dust storm, and then the lag here was much larger. The reason for that is we suspect those particles may be heavier, maybe slightly larger because it's dust from a dust storm. So we think that that 70-minute lag is a little bit, 73-minute lag is much more reflective of these larger particles. And lastly, I want to talk about some of the land use and social demographics. We see that per capita income, tree cover are very related to are very related to each other. Basically, if you're wealthier, and you live in wealthier areas, there's higher chance of having more trees. Similarly, minority populations are generally associated with some of the highest amounts of build cover. And so we can really see it's having trees is essentially a luxury, because what that means is the trees need to be taken care of, and it's no longer a built area that is, for example, homes or commercial areas. So there is a luxury associated with this, and we need to understand that because there are many benefits to having trees. Among them, as we know, we have rising temperature, but what this really means is what is our temperature variability? And as you can see, if just focus here on Salt Lake, you can see that there's an east-west gradient in terms of higher temperatures on the west side of Salt Lake City. This is really, we suspect, related to the built area, because again, if we have more built environment, it's essentially almost like a brick oven effect. It gets warmer, those buildings absorb the heat, and then they radiate it out at night. So that area is much warmer. And so one of the biggest problems is that we have a lower number of air conditioning central air units. Some homes may just have a window unit or a swamp cooler, which are much less effective compared to central air. And so this is a problem in terms of health and being able to sleep. We did a comprehensive analysis of the human health and economic cost of air pollution. Many stakeholders, many researchers put together this effort. And I just want to leave you with one last slide. When we look at environmental exposure, we don't just look at air pollution, but also light pollution, water pollution, and sound pollution, as well as food accessibility. So that is really the comprehensive analysis that we're doing in terms of understanding what potential, what we call the exposome, what are humans being exposed to, which could be determinants of health. So lots of good collaborators and contributors. This is a work of many, many institutions and many individuals. And I'm happy to take any questions. Thanks again.